we'll talk a little bit more. I know that I'm going to be up here for a while. I'll talk a little bit more about the efforts in Congress to repeal and replace. Initially, I had kind of expanded this out to be a huge presentation covering everything about healthcare in the world. I was originally thinking that it was going to be, we would know a lot more about what was going to happen at this point. Much of this is in the balance at the U.S. Senate level. They're concocting a majority caucus in the U.S. Senate is concocting a secret healthcare plan. I'm sure you've all heard about it. So much of my sources are wonderful partners at Community Catalyst, give me great info about rumors and stuff, and they're usually right. And also like The Hill and Politico. So a lot of this stuff is not published in the New England Journal of Medicine. So I will go through, I'll talk a little bit about the procedural status. Much of this you already know. We'll talk a little bit about the content, what's in the version of the U.S. House passed. And then I'll talk just a little bit, I'll just speculate a little bit about the prognosis for passage and maybe some of the whispers that have come out of Washington about what might be in it. And at the very end, I'll talk a little bit about some of the Missouri-specific impact. So, and Jeff and Joel are going to give a fantastic presentation about a lot of this stuff later. It's going to cover some of the Medicaid angles on that, and that's this afternoon. So that will cover a lot of this as well. Timeline. So the application for insurers to propose their rates in the individual marketplace is like next week. It's June 21st. Is that right? Yes. So between June 21st and April 16th, when those rates are locked in and approved by the government, that's kind of this negotiation process. How are they going to, what's the individual market plan going to look like? We all kind of know this. This is how this works in the AHCA. The House v. Burwell case, now House v. Price, was, I believe they filed a case in like 2014, a few years ago, under the Obama administration. It was the United States House of Representatives suing the Department of Health and Human Services, basically the Obama administration, saying that you cannot fund these cost-sharing reduction payments the way you want. You can't just fund them unilaterally. You have to go through Congress. You have to start in the House of Representatives like any other bill. That's ongoing. So that's currently being litigated in the D.C. Court of Appeals, Circuit Court of Appeals, right? So they had a hearing after the election that they postponed because they thought to like May, because they thought that they were going to be able to get something going on repeal and replace. Now they've postponed that to April 20th until after these negotiations about what the rates might be for insurance companies participating in the individual market, because that locks in on August 16th. So the reason why I'm saying this House v. Burwell stuff is, and Mitch McConnell knows this, the U.S. Senate Majority Leader, he has to act. I mean, he could, or the Trump administration could also do this by dropping their case. They could just drive the ACA right into the ground, because they could just say, we're not doing the cost-sharing reductions. And it's like 80%, I think 81% nationwide of everyone on the individual market receives some kind of subsidy for these cost-sharing reductions. The insurance companies are not going to offer it, are not going to offer plans if they don't get this boost from the cost-sharing reductions, right? We all get that. The reason why Mitch McConnell has said he's going to have a vote before the July 4th recess, okay, with the ongoing negotiations with the insurance company and the Health and Human Services, he wants to get a decision on that. And he may, and we'll talk about this in just 1 minute, he may not have the votes. He only needs 50 votes, plus the vice president to break the tie. They're not going to have any hearings. They've pulled a procedural maneuver that rushes it through without any hearings. They haven't even unveiled the bill yet. Once that bill is unveiled, the CDO score will be available within, I'm hearing maybe by the end of this week, but that should be available in a couple of days. So this is just pulled off the CDO score estimate, kind of a goofy looking graph here. Basically, all it says is, I know that some of that stuff is hard to read, but that top column is an individual in the marketplace who's 175% of the federal poverty line or lower. The bottom row is an individual at 450% of the federal poverty line, so well within the middle class. These big numbers are the actuarial value as calculated by the CBO. So as you can kind of see, it shifts the value away from lower and middle income families. And I think that's kind of the takeaway here. We hear about the $23 million uninsured, 23 million more uninsured, we hear about the $119 billion deficit, but this shift in value in the individual market is something that you don't really hear about a lot, but it's something that the CBO goes on at length with. I have that in mind. That should be in the folder as well. So just going through the U.S. House version, you know, many of you know this. I'll breeze through it. Eliminates the cost sharing reduction payments. It shifts it from an age-based tax credit system, or it shifts it from an income-based tax credit system to an age-based tax credit system. That multiplier is currently at 3 times what it would otherwise be for age, is up to 5 times. The MacArthur Amendment, these opt-outs, it's a form of waiver, but this is not like other waivers that we talked about, global waivers. This is different. We're going to call it opt-outs. Basically, the House version allows states with, you know, good cause, quote unquote, good cause to show that they can opt out of essentially any requirement they want under Obamacare, including some of the most popular requirements like pre-existing conditions. Minimum incentive benefits as well. This is a list of them. We all know these. Again, in theory, you know, if this bill passes in its current form, insurance companies will be able to opt out of any or all of those, basically. Eliminates the individual mandate. It tries to make up for that by a combination of these state high-risk pools. That was our Congressman Billy Long kind of pushed that the Long-Upton Amendment adds like $8 billion, and that just pales in comparison probably to what the estimated cost of those high-risk pools will be. There's a 30% coverage penalty for the lapse in coverage, I think it's more than 60 days. Either more than 60 or more than 30 days. And then Joel and Jeff talked about this a little bit later, the Medicaid cuts and restructuring to the Medicaid refinancing mechanism. Yeah, I mean, it's going to completely yeah, I mean, everyone in this room probably will be, if that passes, we'll have to learn a whole new way of, you know, a whole new way of providing services for middle and low income families. Just some speculation about the Senate version. There's a lot. John Thune and President Trump, he's talked about this. The healthcare bill is mean. We're looking for a nicer healthcare bill. That's pretty much what the information, that's the hard info on this healthcare bill right now. There is a lot of talk about soft landing for the Medicaid expansions. So talk about rolling back the Medicaid expansion. There's a lot of talk about stretching that timeline. Right now in the bill, I think it's 2019. There's a lot of talk that that will be stretched to like even 2025. Yeah, so and again, the financing scheme, Medicaid financing scheme, the Senate version may eliminate the block grant option, but include kind of a per capita cap option. Again, this is all speculation, we don't know. Fewer opt-out options for states, that's probably one that'll be in there. But basically say you can opt out of a few things, but you have to cover a few of these minimum essential benefits, and you can't opt out of the protection for individuals with pre-existing conditions. We may see that as well. Probably not going to be fewer tax cuts in the bill. Probably not going to be fewer Medicaid cuts in the bill either. Just from a political standpoint, again, I don't work in Washington, so I'm not the guy for this, but just kind of aggregating some of the sources. The CBO score is going to be important for this version, and it will come out very quickly after they unveil the bill. But as of yet, you know, Paul Ryan, it's a fairly nuanced messaging strategy, but he said, look, of course we're going to have 23 million more uninsured because a lot of people aren't going to opt for coverage because they don't want to pay the individual mandate's not going to be there anymore. It's a fairly nuanced little messaging. I mean, he doesn't seem to be all that concerned with it. Republicans in Washington don't really seem to be all that concerned with that. But it will come out and it will be a talking point for people on both sides of the issue. The opt-outs, and I'll talk with our keynote Lauren here a little bit about this in a minute, but you know, a few years ago we all thought that states wouldn't turn down the matching funds for Medicaid expansion, right? Like we were like, why would we be so stupid to do that? Well, here we are in 2017, and a lot of states, including Missouri, hasn't done that. Right now, a lot of people in this room are thinking, these states aren't going to opt out of the protection for people with pre-existing conditions. If that's in the bill, who knows, man? I mean, they might. So that's a political viability thing. Again, it's important to remember, states like Indiana, Ohio, Kentucky, they passed Medicaid expansion. And I think that we can maybe draw some parallels between them and now. So, again, I talked about this a minute ago, the individual market viability, like, if there's no insurers available or one insurer available, like, and if we don't get the money for the cost sharing reduction payments, nobody's going to be on these. I mean, nobody's going to be on the marketplace. So if they don't pass repeal and replace, they drop the case in the House v. Burwell. I mean, there's going to be a lot of Americans are going to be out of a health insurance plan. Senator McConnell does seem he does want to vote. He is for the last 3 days. He has said we're going to get a vote before the July 4th recess. So Community Catalyst, my guy Kyle Stock says that means it'll be maybe June 29th, but more likely June 26th will be the deadline for that. He may not have the votes for that. He may not, but yeah, I think we're going to get a vote up or down either way. Specific to Missouri, and I've included this in your packs, you know, the marketplaces, you know, have gone into effect in Missouri. Has reduced the overall number of uninsured in Missouri by a significant margin. That comes from the Census Bureau. It roughly tracks U.S. fall in uninsured rate, but many states in the U.S. have, you know, adopted Medicaid expansion. You know, the number of Missourians in the marketplace is between 100% and 150%, especially 138% for the federal poverty line, staggering. Our percentage of that population is far greater on other states, because you have to remember in many states the 100% to 138% are covered by Medicaid expansion. 87% of individuals in the Missouri marketplace receive some kind of subsidy from the government. 57% of those receive cost sharing reductions of the kind at stake in the House v. Burwell case. Again, we talked about it a minute ago, failure to expand Medicaid. There's a lot of uncertainty in Missouri as we look into the repeal and replace bill. So, yeah, that's my presentation about the AHCA. Again,